My name is Kelly Mullen, and this is our project on hypertension. Julie Edwards and I are doing this presentation. It's an educational project on educating on the signs and symptoms of hypertension and also ways to prevent it and the ways that you treat it. We're going to start out, we have a video presentation, slideshow, as well as we're going to take blood pressures afterwards, and we have our panel here with 3 people, one who has hypertension and is actively taking medication for it, another person who is diagnosed with hypertension, but we're not quite sure if she medically manages it or not. Then we have another patient who might be at risk for hypertension. So we're going to start our slide presentation with hypertension. And are you at risk for a heart attack, for a stroke, or heart disease? These are complications of hypertension, and we're going to learn what hypertension is and how to prevent it. Blood pressure is expressed in 2 different numbers, a systolic and a diastolic. These 2 numbers represent the pressure against the walls of your blood vessels as the blood moves through them. The top number, or the first number, represents your systolic pressure, which occurs when the heart contracts. The bottom number, or the second number, represents the diastolic pressure, which occurs when the heart relaxes. Normal blood pressure is less than 120 systolic and over 80 diastolic, typically written as 120 over 80. Hypertension, or high blood pressure, is persistent systolic blood pressure greater than 140, which is your top number. The organs and tissues in your body need oxygen to survive. The oxygen is bound to your blood and is delivered after an exchange of carbon dioxide for oxygen in your lungs to your body by the blood vessels. So when your heart beats, it creates pressure that pushes that blood through your arteries and veins, also known as blood vessels and capillaries. Blood pressure is the force against the blood pushing against the blood vessel walls. Your blood pressure must be within a normal range to properly deliver this oxygen-rich blood to your organs and tissues in order to survive. We have a picture, you go back one, Julie. We have a picture up there that shows the inside, and those are the pressure points that we're looking for. The pressure must be normal in order for that blood to supply the brain, the lungs, and perfuse all the organs of the body. And if something impedes that area, that's when you start having other problems, and it creates a risk for cardiovascular disease and or stroke. So when somebody has high blood pressure, that increased force makes the heart work much harder to pump that blood throughout the body. The increased force puts strain on both the heart and the blood vessels. If the force of the blood flow is high for a length of time, eventually that tissue that makes up the walls of the arteries gets stretched beyond its healthy limit. The overstretching of those blood vessels makes them prone to rupture. Damages to the vessels results in the development of arterial sclerosis, which is hardening of the arteries. Uncontrolled high blood pressure increases your risk of serious health problems, including a heart attack and stroke. Who's at risk for having hypertension? Age is a factor because blood pressure rises with increasing age. Alcohol, excessive alcohol intake is associated with hypertension. Cigarette smoking, diabetes, hypertension is more common in diabetics. Elevated cholesterol and triglycerides, those high levels are primary risk factors for arterial sclerosis, which is the plaque buildup in your vessels. Too much salt in your diet, the high sodium intake contributes to high blood pressure and it causes water retention. Gender, hypertension is more common in young adult men and middle-aged men, and after the age of 55, hypertension is more common in women. Family history plays a role also with hypertension. Obesity, weight gain is associated with increased frequency of hypertension, especially when you gain weight in the abdominal area. Ethnicity, the incidence of hypertension is twice as high in African Americans as it is in whites. Sedentary lifestyle, the inactivity and weight gain are associated with high blood pressure, and it increases the risk for heart disease. And stress. People exposed to repeated stress may develop hypertension more frequently than other people. And we're going to talk about the signs and symptoms to look out for. Hypertension is often known as a silent killer. because it frequently is asymptomatic, meaning that without symptoms until it has become so severe that damage to the organs has already occurred. A person with severe hypertension may have symptoms caused by the effects on the blood vessels, which can be, you can feel fatigue, inability for activity tolerance, dizziness, palpitations, angina or chest pain, and difficulty breathing. According to the American Heart Association, there's a common misconception that people with high blood pressure will experience symptoms such as nervousness, sweating, difficulty sleeping, or facial flushing. The truth is that high blood pressure is largely a symptomless condition. If you ignore it because you think the symptoms will alert you to the problem, you're taking a dangerous chance. Everybody needs to know their blood pressure numbers, and everyone needs to know to prevent high blood pressure from developing. There are also myths of headaches and nosebleeds believed to be related to high blood pressure. According to the American Heart Association, studies have shown that people with higher systolic, your top number on your blood pressure, were up 40% less to have headaches. It's important to know that nosebleeds can be associated with other factors. Most common are just dry air and climate changes. Others may be allergy, sinusitis, or anticoagulants such as warfarin or taking aspirin.
Okay,
I'm going to switch off.
let's talk about some complications of hypertension. Cardiovascular disease, heart failure over time. As the heart works harder to push the blood throughout the body, the heart enlarges. Just like any other muscle in your body enlarges when you work it out. This enlargement causes stretching of the heart muscle, and eventually not enough blood is pumped out of the heart to the body to meet the body's requirements of oxygen, as discussed earlier. Other complications are vision loss, kidney damage, chest pain, stroke or heart attack, coronary artery disease, and hardening of the arteries. So this slide shows classifications of blood pressure. A normal blood pressure is less than 120 for the top number and less than 80 for the bottom number. Pre-hypertension starts with the top number at 120 to 139 and with the bottom number 80 to 89. If you're diagnosed with stage 1 hypertension, the top number is 140 to 159, or the bottom number is 90 to 99. Stage 2 is greater than or equal to 160 for the top number and greater than or equal to 100 for the bottom number. What are some ways that we can prevent hypertension? Some of the ways Kelly discussed earlier, but maintaining a healthy weight. A weight loss of even 10 pounds can decrease your top number by 5 to 20 points. Exercise at least 30 minutes of aerobic physical activity, brisk walking, jogging, swimming, most days of the week. Reduce salt intake. Don't eat a lot of frozen foods or processed foods. Increase your level of physical activity, limit your alcohol consumption, and monitor your blood pressure regularly. Some more ways to prevent high blood pressure is having a body mass index of less than 25%. Your diet, as we discussed, eating 5 or more servings of fruits and vegetables a day. Exercise, and if you smoke, don't smoke anymore. Get help and limit your alcohol. Regular checkups with your doctor and lab work. Monitoring your blood pressure. Your blood pressure should be taken during your regular health checkups. Your doctor may recommend checking your blood pressure at home if you have risk factors of hypertension or if you have been diagnosed with pre-hypertension. You should keep a record of your blood pressure at home for your healthcare provider. And the American Heart Association recommends an automatic cuff-style bicep upper arm monitor. Wrist and finger monitors are not recommended as much because the readings are less reliable. But today we're going to show y'all how to do one with a wrist monitor. also buy a manual cuff and learn how to, we could teach you properly how to use one of those, but it's just easier to use a wrist or upper arm electronic one at home. Or if you're grocery shopping at Publix or Winn-Dixie or Walmart, they have those machines that you can keep a checkout on it there. That's it. So,
We're gonna try to do a blood pressure. This wrist cuff. Go and get a scalp. I'll grab a scalp. We're gonna try one with the wrist monitor, and then I'm gonna use a hospital-approved blood pressure monitor because luckily we're in the hospital and we can utilize this. Let's see. And I need you to sit with your feet uncrossed, and we'll hold your arm down like heart level, okay? This should give you a heart reading and also a blood pressure reading. Now, did you take your blood pressure medication today?
Yes, I
Okay.
do. How reliable is it?
Well, I did it twice when I practiced it. It shows you at 170 over 90 with a heart rate of 64. So we're going to try this one. This is what we would use if you were a patient in the hospital.